to the plate.
You got to live it up now, because with this Omicron on the way, if Dr. Hoa Nguyen texts me, get ready for January 2022, I get nervous. I don't do well when I'm nervous. We're laughing now, Doc. Laughing now.
I know. We got to enjoy the moment, guys.
Yep, that's it. Live in the moment. Doc, so
enjoy the moment.
Dr. Hoa Nguyen is coming to us all the way live from Pensacola, Florida. Sunny Florida, Doc. Wow.
It's beautiful. It's very nice and sunny and 65 degrees, so it's very good.
Wow, that's like a little bit of aircon, but in the sunshine. Well, it's pretty nice and sunny there, but what's the situation with the COVID? Dark?
Yeah, the COVID in the state going crazy. You know, I think 95+% now. Everything else is that they have here is Omicron. And, you know, we fully expected to maybe arrive in Guam sometime in January. You know, if I don't think Omicron is there yet, because once it's there, you know, we most likely will see the number come up to 100 in about within a week or so. They're very, very infectious here. So I say that during the holiday, you know, especially Christmas and New Year, you know, the gatherings, our people had to be very, very particular and very take a lot of steps to avoid large gathering with people that with outside the immediate family. Because I tell you, once it hit, it will hit a lot of people. Fully vaccinated, but not boosted, will most likely will be positive also. So we fully vaccinated, they really have to be careful on what they do. They will get infected. So doesn't mean that you fully vaccinated that you can drop all your guard. So I encourage people in Guam to be careful, and also that I hope that public health have some well planned together and how to approach the Omicron based on the last surge with the Delta, because this one will more likely result in a lot more positive in the community. So we really have to ramp up the testing. I think that Tijan will be the only site will be a problem. They need to have more testing site than just Tijan, just because we're going to have a lot more people lined up to be tested. Right now in the state, testing is a big problem. There's testing usually wait anywhere from 2 to 7 hours to get tested. And people cannot buy the home test kit here anymore just because they all are gone. So I think public health need to stand up a lot more testing site in January, February in order to deal with the Omicron. And they should have a clear message of how to isolate and quarantine once you test positive. So that's something we have to deal with. You know, just like in the state, there's a lot of labor shortage now just because so many people turn positive. So workplace employer have to kind of modify their business in order to deal with the positive in their business. So that's something that even in our clinic, we will have to plan ahead of time, because I'm sure that some of our staff will turn positive, and if we need to curtail the service, we really have to. So that's something the business have to plan ahead of time for the Omicron.
Doc, you keep saying the P word, plan ahead of time. We haven't heard anything from public health about any type of plan that they're doing for the Omicron variant. And meanwhile, when you talk about gatherings and not hanging out with people within your immediate family, I mean, Sus Maria say, it's the holidays. Of course we're gathering with people who came from the States, didn't go through quarantine, you know what I mean? Or maybe 1 shot vax, 2 shot, not boosted, whatever. So I don't know. It seems kind of ripe for a a surge type situation, Doc. And it's it's a
Yeah,
little.
I think that before I left, we already see some few people come from the state that test positive as they land in Guam. So that's why the message is that you have family member that come from the state. Just go out there and get them tested. Just to be sure. I think that's something that you need to do to protect your family because you never know. There's a lot of cancellation here of the family gathering, and for people I know here in Florida and Louisiana, just because there's so many Omicron positive around that. Even our family, we cancel the annual get together just because there's a few people that turn positive. And the dangerous part about it is that some of them are asymptomatic, but they still can transmit the virus. So, like I said, go out there and get tested. If you're going to have a family get together, I think public health, they still have testing site at the Tejan during a certain day. Go out there and get tested within 24 hours before your gathering, just to let you know that, hey, I'm negative. So at least you have take an extra step to protect yourself and the family. So that's what I would rather people do. Right now, I see the testing is very limited, less than 200 tests a day, and that's a big concern that we have such a low turnout for testing. I would encourage people to go out there and get tested before your gathering, just so that way you ensure that it's safe for everyone in your party there.
We had a comment here from Rosemary. For months, the people have been asking for more testing sites, and public health has been saying for months they're in the planning stage. This is ridiculous that no plan has been implemented yet.
Yeah, I tell you, when Omicron hit, Tejan alone won't suffice. I tell you, it will be overwhelmed, and people are going to wait several hours to be tested. They should have multiple testing sites open so public can go out and get tested. And I tell you, that's what we learned from Delta. And this one is the severity so far is much less than Delta, but I'm telling you, it's very infectious, and we will break our record on this positive. I think last time we had like 236 or something. We will break the record in one day with Omicron.
Doc, so, I want to key into what you said there, and this is, I think, what the only thing people are taking away from this whole Omicron thing is the words less severe than Delta. And so I feel like people hear that and they just check out. You know what I mean? Oh, it's nothing to worry about.
No. It's less severe, but remember, all of us have family members that have comorbidity, right? So it might be less severe for the young, healthy population, but when you have so much comorbidity, you're going to take the risk of end up in the hospital just because you have your immune system is not as well as other people. So yes, in the general population, when you're healthy, it's going to be much less severe. But we don't know, right? Our comorbidity in Guam is so high that you can see that with Delta, there's so many people that end up in the hospital, and we lost so many people already. So that's what the important people got to understand is that, yes, you can hear, you can read, you can do everything about severity of the illness of the virus. But again, with our population in Guam, it's yet to be seen. So we had to be very cautious, and it's never hurt to over plan and over cautious about something. Rather, when they get there and you're not planning and you don't take all the precaution, and we're going to lose more people. So, the only message I want to get across to people is that, hey, even you're fully vaccinated, Omicron will still going to infect you, and people that have previous Delta infection in the past few weeks, the past few months, Omicron will overrule that and infect you again. So it's very unique. So really everyone had to be cautious about this thing. And also it's affect the children a lot more than Delta. So, the children don't get much in trouble, but we cannot afford to lose one child.
Margaret Hattori Uchima. Good morning, Miss Margaret. Comments in here, Doc. Why risk it for our elders, our manuncle, and those with diabetes, kidney failure, etc.? Let's play it safe and don't take Omicron lightly. Please, thanks, Dr.
Yes,
Hoa, for sharing your knowledge.
yes, and I tell you, she hit the bullseye right there. Um, I'm telling you, we need to have more planning out there, more education, uh, a much more clear guideline for public health on isolation and contact tracing. Well, we have to put that in place and very clearly. We often hear people have different instruction on isolation from different people from different area of public health, and there should be one unanimously one sentence say you got to isolate it a certain day according to the guideline and go get people tested. So we really need to get those guidelines out like as soon as possible. I cannot tell you enough that it's very urgently that we need to educate our people during the New Year celebration. I know it's a hamper and it's a put everything negatively during the holiday, but we have to say something, right? Because it's coming, and we know it's coming, and I'm very sure January we're going to get hit.
Yeah, Doc, but how do we know that the current head of the Physicians Advisory Group, Dr. Berg, is not telling the governor, like, oh, it's coming, yeah, but, we can't stop it. Might as well just let it come and get everywhere like they did with the Delta surge. I mean, because I guess that was his advice.
I know. Well, we lost more people than we can afford to lose in the last Delta surge, and everything we read, again, our population is different. There's no such thing as over plan and over cautious on this thing. We say we have a lot of elderly in our community. A lot of people have multiple comorbidity. We have to protect them. And like I say, it's a responsibility for everybody. So please, everyone, be safe during the holiday. And we really want to see much more tests per day rather than just a few hundred tests a day that I just saw in the past few days. Because you'd rather be tested the day that you have your gathering. That's the safest way to go into the holiday.
We had another comment. This is such a bullseye as well. Rosemary comments, the governor's statement on, quote, shuttering up for impending Omicron storm, but then she raises the social gathering to 100 people is a conflicting, disheartening message. I thought I was the only one that noticed that. Yeah, but it's like how many mouths you have that you're speaking out of at the same time.
Yeah, she's correct. Even in the big city like New York, they the New Year celebration, they cut it down quite a bit. I think they like 15,000 now, and they have to social distance there, and they have to be fully vaccinated, and they have to be masked. So I think that for us to have a large gathering at this point with Omicron coming, I know it's not a popular decision, but I think that if I'm the governor, I would cut that down, just anticipating Omicron arrival on island because so much traveling from our relative from the state to come to Guam.
Doc, so I hate it when you're right. I do. I really hate it when you're right. You were right about this Delta surge. You were the first voice warning everyone that this Delta surge, where you're right, we lost way too many people because our government didn't do enough. That's the reality. But you were the first voice to come out and warn of it, and no one listened. And, all those deaths, all those cases, I mean, a surge that lasted months. So I know they're listening now. You're the former head of the Physicians Advisory Group. If you had the governor's ear this morning, what would you tell her to help her prepare for the Omicron storm?
I would say that prepare by standing up, plan for more testing site during the new year and also after the new year in January. And really, I would like to see if we can cut back in the gathering, put some restriction on it. Doesn't matter indoor, outdoor, doesn't matter what your vaccination status is. The vaccination status of vaccine, unvax is history. We way past that already. So I think that we should treat all the people of Guam as the same. And I think that we do that with the cooperation of everyone, the restriction of the number of people on the gathering and increase of testing. I think that's the number one thing that we can try to hold down this surge as much as possible. And again, encourage people to get the booster if they don't have it yet. Those are stuff that if I make a decision, that's what I would do. But I would not sit back and not do anything before the new year come in a few days.
All right, Doc.
Okay, guys, just please be safe, and I keep my prayer for our people of Guam, and wear your mask and be careful, and hopefully we come through the Omicron, maybe much more positive, but we lose much less people that we lose rather than the last surge. Okay.
Thank you, Doc. That's doctor's orders with Dr. Hoa Nguyen. By the way, Doc, I want to just end on a positive note, not a COVID positive note. Pensacola, Florida. I know you're visiting your brother out there, right? So
yes.
How's that going?
Oh, it's very good. We have strictly gathering only immediate family. No one else come except immediate family. And I know I'm kind of a little bit anal, but we test everyone before they come.
So you're the anal one in the family. Got it. Wow.
I'm sorry.
No, I'm saying, Doc, it is what it is, man. How's the fishing?
My mom is, she's 86 years old.
Oh, wow.
We got to protect her.
Wow, yeah.
Yeah,
that's great. Good to hear, Doc. How's the fishing, though? Have you got to go fishing yet?
Oh, no. I tell you, I just enjoy driving around with this the beautiful weather here. Yeah. And just sit down the porch and look at the water. It's very relaxed.
Right on. Well, you relax and get ready to come back here. You never know how hot it's going to be when you come back.
I know. I hope my plane is not going to get canceled, because a lot of flights are getting canceled because no staff.
Right. Thank you, Doc.
Yeah.
Safe travel.
Okay, guys.
Okay, there you go.
Be safe, okay?
Dr. Hoa Nguyen, they're the former advisor of the Physicians Advisory Group. Remember, this is the group of doctors. They advised the governor on how to move during the pandemic. He was very key and instrumental in a lot of the decisions that were made early on in the pandemic. But remember, he left the Physicians Advisory Group because of what he called political interference. And when I asked him, hey, which part was like the